My name is Karen Mercereau. I am CEO of RN Patient Advocates, and we produce the Medi Key. $1 trillion a year is spent as a direct result of medical errors. Up to 440,000 people a year are dead simply in the hospital population due to medical error. Patients do not own their medical records, so the Medi Key, the patient will own all of their records. It is put in a form where the physician can access all critical information at a glance and prevent medical errors, prevent those deaths, reduce those costs.
Hello, and thank you very much for coming this evening. I would like to introduce you to Ron. Ron is a 65-year-old CPA, and he can't walk. He's in severe pain. He's clinically depressed. He has poorly controlled diabetes. He has hypertension. He has black ulcers on both of his thighs, undiagnosed. And he has a pacemaker. Now, Ron also has 6 different doctors, and he has been in several hospitals dozens of times. What does this mean? This means that his records are scattered amongst all of the different providers because they operate in silos and the communication amongst offices is fragmented. Now, you have to keep in mind that 70% of people Ron's age and older, 65 and more, have 5 or more chronic illnesses. That means they have several different doctors and their records are scattered, right? There are 40 million of us. I'm 65 or older. There are 40 million Rons in the United States at this time who have multiple chronic illness, and their records are scattered. So these people are at high risk for preventable medical error. They are at risk for unnecessary pain, unnecessary cost, stress, and ultimately preventable death due to medical error because of lack of communication, lack of information. Now, what's going on here, really? You may not be aware that your medical records live in a lot of different places. And what does that mean? That means that your doc is having a hard time accessing all the appropriate information that he or she needs to make the best choices for you. This leads to 400,000 deaths a year due to preventable medical error, and that is just in the hospital population. People are not aware of that, but it's true. Also, the number of are you aware that the number of misdiagnoses is really high? It can go as high as 40% in the emergency room because they don't know what's going on. They're shooting in the dark. This all costs a whole lot of money. It costs $1 trillion down the drain to the U.S. economy every year just because of preventable medical error. So what are we going to do about it? Well, a group of experienced clinical RNs figured something out. It's called the Medi Key. Now, the Medi Key is the key to unlocking all the essential information that your physician needs to make the most appropriate diagnostic and therapeutic choices for you. It's a personal health analytics tool. It's a health summary and a chronology. We utilize medical forensics to uncover all the underlying connections which are making your condition worse and which are not addressed by multiple medications that you may be taking. We are tracking trends. We're finding the gaps. You know, what hasn't been done? What questions haven't been asked? We're also picking up all the errors. You may not be aware, medical records are full of mistakes because everyone's in a hurry and stuff gets on the wrong chart and it stays there forever. We also do find all the hidden critical facts, the little things that are critical, but they're buried in the record. It also provides a roadmap to health. What's that? Well, These are all the questions that haven't been asked. These are all the approaches that haven't been tried. This is a direct result of researching the globe for the most effective therapeutic and diagnostic choices for you. So, in order to do this, we have a very big stack of records, right? We collect them from all these different places. We've got a big stack of records. And we actually read them. We read every single page. And then we turn it into this. This is a real Medi Key right here. Here's the summary and the chronology. Here is the lab trends, all of the critical labs that your physician needs to understand. Physicians almost cry when they see this because it's all in one spot and they can access it immediately. And here is the roadmap to health. All the questions that you need to ask your physician, all the things you need to learn to protect your health and well-being moving forward. So, who's going to do this? Oh, you know, before we get into that, what do you think your doctor's going to want to read? Is he going to want to read this stack, or is she going to want to read this stack? I'll tell you, it's this one. This is widely accepted by physicians and institutions alike. Now, the early adopters, how did I scoot ahead? Forgive me. The early adopters are people 50 plus years. Why is that? Because they're the ones getting sick. They're the ones developing chronic illness. Okay, the top 3% of earners. Why? Because they can afford it and because they are very concerned and proactive about their own health. C-level executives in order to comply with corporate governance, and high-value people purchasing high-value, high-deductible insurance. There are 53 million boomers with multiple chronic illness at this time in the United States. The top 3% is 1.6 million. Now, assuming a 4% conversion rate, that brings us up to 64,000 people right now today who absolutely need a Medi Key to protect their health and well-being. You know what that's going to bring? That's a $115 million revenue stream. We are connected across the country. The Institute for Functional Medicine provides the scientific underpinning for our forensic work. Lifetime Health Diaries, a partner, they are a very innovative data management company their mission is to privatize health information, making it yours and pulling it into one's place. College of Nursing at the university, which has been a strong partner for many years, and Startup Tucson, to which I was so fortunate to be selected, who have been instrumental in helping to hone this message and get us ready for the next level. I'm Karen Mercereau, and I started this 13 years ago, and I've been around a really long time. 47 years. Blows me away. 47 years. I've been recognized locally as well as nationally for this innovative work. Our team, Dr. Joan Shaver, who is the Dean of the College of Nursing and visionary leader, Dr. Barbara Brewer, strong background in research as well as business, Judy Klinko, who is a community leader in all things having to do with the seniors population, and the RN patient advocate group practice of Arizona, highly skilled RN patient advocates who are turning these Medi Keys out every week. Preventable medical errors and deaths are escalating. Here's the solution. It's the Medi Key, it's the solution. Medi Key saves lives and may actually save your life. Now I want to tell you, remember Ron, right? Putting together his Medi Key, utilizing all of that information to direct the team, within 3 months he was back at work from near death. And I would suspect that everybody in this room knows somebody 50 or older who has chronic illness, possibly 2 or 3 different docs, and they are at risk for preventable medical error. I would like to ask you to give him my number. Thank you very much.